So let me say good morning again to everybody here. It's my pleasure to welcome you all, both here in person. I understand we have an overflow room elsewhere here in Keck, as well as joining by webcast. My name is Jeffrey KAHN. I am director of the Johns Hopkins Berman Institute of Bioethics and the chair of the planning committee for this workshop, title of which you see here on the slide. Let me offer a few reminders about Academies events and in particular about workshops before I offer some opening remarks related to the topic of today's workshop. So the Academy's role, of course, is to convene experts, and we bring together a variety of stakeholders, people with various expertise, as we've done here today, to provide their perspective and facilitate attention, visibility, and discussion of critical and emerging issues. We hope that a workshop like this one will help to set the stage for future policy action and facilitate public education and discussion of issues. It's important to note that while we will not make consensus recommendations, that's not the purpose of workshops. As part of today's discussion, the presentations and discussions will be captured in a proceedings of this workshop published by the National Academies and released publicly in early summer. We should thank the sponsor for today's workshop, which is the Office of Science Policy of the National Institutes of Health, so thank you. And as I said at the outset, the day is being webcast, and as a function of that is also being recorded. So we ask that you speak into the microphones that are set up around the room when it comes time for questions and discussion after the presentations from our speakers and panelists. And when you do that, please clearly state your name and your affiliation for both people in the room and on the webcast and for the record. Okay, with that, let me just make a very few short comments about the topic today. And to say at the outset that many members of the bioethics community, myself included, have benefited from funding from the NIH, whether through bioethics-focused investigator-initiated projects and research, inclusion of a bioethics component in biomedical research projects performed by our colleagues in science, or bioethics researchers embedded within biomedical research to examine and analyze the ethical issues raised, or through support as trainees in bioethics-related training programs. The majority of bioethics-related research funding over the last, I would say, 2.5 decades now, 25 some odd years, has focused in 3 main areas, mostly genomics, first and foremost, through the Ethical, Legal, and Social Implications, or ELSI portfolio, administered by the National Human Genome Research Institute, that's NHGRI. Second, on the ethics of biomedical research, which is more broadly supported by a combination of institutes across the NIH, and on bioethics capacity building outside of the US through the portfolio administered by the Fogarty International Center. Recently, the NIH BRAIN Initiative included and includes funding for neuroethics research, and 2 very recent and new RFAs have been issued, one for administrative supplements examining bioethics issues to inform policy, and the newest of all from the National Center for Advancing Translational Science, or NCATS, on ethical issues in translational science research. So an expanding portfolio. But speaking for myself, and I think channeling the many colleagues with whom I've worked and had discussions over the years, the support for bioethics research has been critical to the development of the field of bioethics and to many of our careers, but has had the effect, predictably so, of focusing our research into the areas I've described, an increasing range of areas, but nonetheless limiting us in some ways. There are, of course, many bioethics topics and approaches to studying them that fall outside of those in the current NIH funding portfolio, a fact that many of us have experienced firsthand, of course, whether we are discouraged from seeking funding or unsuccessful in doing so. And so today's workshop is an important and opportune beginning, and one for which our colleagues at the NIH should be congratulated for prompting, of a discussion of what topic areas might be included as we talk about, and hopefully our colleagues at the NIH consider how to expand the bioethics research portfolio. So a few points to add to what I said as a matter of introduction. This is a one-day workshop, and it's a full day at that. Many topics could have been included in the agenda today that are not. Those we will address were identified by the Planning Committee as being particularly ripe and important to pursue, but are by no means meant to exclude others, and we look forward to hearing about those others from you all during discussions today and as part of the survey and evaluation that you'll get after today's workshop. So we look forward to feedback both today and through other means online and by writing. Just another bit of housekeeping. Moderators will introduce themselves and the members of each panel. And I think with that, I just want to say again, thank you all for being here and in advance for what I know will be spirited participation and discussion. Let me welcome my colleague Bernie Lowe to the podium to introduce the first panel.